Thank you, Adam. So we've talked about the science behind the BIS technology in an earlier presentation, so I won't go into too much detail. But the main takeaway is that the measurement of bioimpedance is an indication of the fluid present in the body, because the current will always flow through the path of least resistance, which in biological tissue is the fat-free mass and fluids rather than fat or bone. At low frequencies, the applied current used to measure the impedance cannot penetrate the cell membranes and so flows through the fluid outside the cells, shown here in a healthy limb in the left image. When the volume of lymph increases, as in the right image, the current flows with less opposition and therefore a decrease in the measured impedance at low frequency, which is also called R0, and this reflects an increase in the extracellular fluid levels. Current methods of measuring unilateral lymphedema of the limbs, other than BIS, measure the total volume, are expensive, invasive, or do not discriminate between extracellular fluid changes and other volume changes. BIS, on the other hand, is simple, non-invasive, and measures the impedance, which reflects the changes in the fluid levels. We can see here the importance of being able to measure just the fluid component when we assess lymphedema. In the first case here, the initial composition of the arm is very simplistically represented by muscle, fat, fluid, and bone. In every case, the total volume of the limb remains the same. In the second case here, the muscle component has increased while the fat has decreased. Perhaps the patient hit the gym and improved fitness since the last visit. In the third case here, the amount of fat has increased and the muscle mass decreased. Perhaps there was a global pandemic and the gym had to close. In the fourth and final case, we can see here that the fluid component has increased while other components have decreased to compensate. It is only by using BIS technology that we have the sensitivity to identify that an increase in fluid has occurred. A total volume measurement does not capture this increase. BIS, on the other hand, allows us to discriminate between the components of the arm and measure a representation of the extracellular fluid, and is therefore able to be much more sensitive to measuring changes in lymph fluid. To assess unilateral lymphedema, we measure the extracellular impedance, or R0, of the at-risk limb and compare it to the extracellular impedance, or R0, of the healthy contralateral control limb. In a healthy population with normal variation between the contralateral limbs, the R0, or extracellular impedance, of both limbs will be similar. But with lymphedema, the R0 of a limb with excess fluid will be smaller due to the higher lymph volume. We track the ratio of the control limb divided by the at-risk limb because in the case of a lymphedema patient, the unaffected control limb will always have a higher R0 value than the value of the affected limb, and therefore this will give a ratio greater than 1 that increases as the extracellular fluid in the affected limb increases. This limb ratio is then converted to an L-Dex score by comparing it to the mean and standard deviation of a matched healthy population, taking dominance into account. The L-Dex score is a more manageable index for tracking the changes in impedance. In the L-Dex scale, -10 represents 3 standard deviations below the matched population mean, and +10 represents 3 standard deviations above the matched population mean. Okay, so now we'll have a look at an actual measurement for unilateral lymphedema being taken on the SOZO device. So this is a video of the tablet as it's taking a measurement. First, we need to set up the patient profile. So we choose the L-Dex assessment type. Then we have to set the L-Dex, the lymphedema settings. So we choose unilateral lymphedema. In this case, we're measuring the arm. We also select the at-risk limb being the left limb and the limb dominance of the subject being the right limb. We then can see the details of the patient that we're measuring. So we choose to take a measurement by clicking the measure button, which before we take a measurement, we're presented with some tips on how to get the best quality measurement. We enter the weight and we can see a brief tutorial of how best to place the hands and feet on the device to take a measurement so that we get the best contact with the plates. We then start the measurement by pressing the start button, and there is a countdown. So if you were to be taking a measurement on yourself, you do have that time to place your hands properly. This is where the measurement's taken. So we do a sweep of the right side of the body, and then a sweep of the left side of the body, and then all the calculations are done. And then we're presented with the results. So we're presented here directly with the L-Dex score, but if necessary, you can review the Cole plots if you wanted. So here we can see the L-Dex score presented on the L-Dex scale. And then further down, we can see the history. Now, in this case, we only have one measurement that's been taken. However, when we do take a measurement, what's a good idea is to set the baseline. So we can do that by choosing the history for the patient and having a look at that history chart and selecting a particular measurement for the baseline. Now, we've only got one measurement here, but ideally it's a pre-surgical or pre-treatment measurement, and we select that as the baseline. So that's been updated. We then go back to the results that we just saw. So we click on the results button, which then presents us with all of the measurements that have been taken, and we select by the day and time that the measurement was taken. And now we can see when it presents the measurement that was taken, we should be able to see that we can have set that baseline. So we can see here that now our baseline is set to 1.7, and we have a change of 0 from the baseline, which makes sense because this is the baseline measurement that we're looking at. And we can see here now on the history graph that we have a constant line at that baseline, so that tracking from that point is now made a lot easier. So we can see here the L-Dex scale with an L-Dex score for unilateral lymphedema. A unilateral L-Dex score is best suited for measuring patients with only one limb at risk. This is because we use the contralateral limb as a control comparator when determining the L-Dex score, and the assumption is that it is a healthy limb which will not change over time. As a result, the fluid state of the contralateral limb is important to consider. So if you have an injury or a fallen and have a swollen knee or elbow in what we are assuming is the healthy control limb, this will have an effect on the L-Dex score calculated because it uses the impedance of the limb. So the resulting L-Dex will then be confounded with changes or abnormalities in what we're assuming is the healthy limb and not representative of the state of the at-risk limb. So this is something we need to be considerate of. An L-Dex score can also be positive or negative. 99% of healthy individuals are expected to have an L-Dex score between -10 and +10, and 95% will have an L-Dex score between -6.7 and +6.7. Statistically speaking, we would expect 50% of healthy individuals to have a negative L-Dex score. So this is not something to be concerned about if you see it in your patients. For some people, differences in anatomy between contralateral limbs will result in a negative L-Dex score. An L-Dex score lower than -10, so in the grey region, should be investigated, however. It may be that the at-risk or dominant limbs have been mixed up, or the quality of the impedance measurement is not adequate in a limb. The L-Dex scale color codes the section of the graph to help clinicians identify the trigger points at which treatment may be initiated. A green L-Dex score is considered within the healthy reference range. A yellow L-Dex score indicates that the L-Dex score is 6 units or approximately 2 standard deviations away from the population mean or baseline measurement, at which point evidence from published studies show intervention can prevent the progression of lymphedema. A red L-Dex is considered outside the healthy reference range as it is more than 10 units or 3 standard deviations from the population mean or baseline measurement. For best results in tracking, a patient should have a baseline measurement taken prior to cancer treatment and regular measurements continued after treatment. Having this baseline shifts the green, yellow, and red sections of the scale in comparison to that baseline rather than the population mean. This allows the healthy ranges to be individualized to the patient and tracked over time to ensure the earliest intervention and the best possible outcomes. I'd now like to pass you over to our clinicians who will present their clinical experience using L-Dex for unilateral lymphedema.